Hello, I'm Ashley Bjorklund. I'm the medical director of the Pediatric ICU and the co-medical director of the Pediatric Brain Injury Program at Hennepin Healthcare. Today we're going to talk about mild traumatic brain injury, also referred to as TBI and commonly known as concussion. If your child or teenager has experienced a bump to the head, it can be scary. This information is essential for navigating the injury and helping your child recover.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Brain injuries are classified by severity: mild, moderate, or severe. Most TBIs are mild, involving a disruption in normal functioning and a brief period of loss of consciousness or altered consciousness, such as disorientation, confusion, or being unable to follow simple commands. In this video, we will discuss mild traumatic brain injuries in more detail. But remember, just because it's mild doesn't mean it's not significant. The brain is a delicate organ, and any injury should be taken seriously. Children with a mild TBI can have a variety of symptoms. Symptoms can vary widely from person to person and may appear right away or develop over the next few days. Every brain injury is unique, and recognizing these symptoms is vital for recovery. Let's break these down into four main categories. First is thinking and remembering, sometimes referred to as cognition. Your child might find it difficult to think clearly, concentrate, remember things, or follow conversations. They may feel dazed or foggy. Next, let's look at physical symptoms. These can include headache, dizziness, sensitivity to light or noise, fatigue, feeling nauseous, or blurry vision. Another category is emotional health, symptoms related to mood and emotional well-being. Your child may feel more irritable, emotional, anxious, or sad. This emotional response is normal, and patience is key during this time. Finally, let's talk about sleep symptoms. Many children experience changes in their sleep patterns, whether it's trouble falling asleep, staying asleep, or sleeping too much. All of these symptoms can be frustrating for your child, but they also are all common part of recovery and should improve and go away as the brain heals. Symptoms in infants and toddlers may look similar to those in older children, or they may present a bit differently. Young ones aren't generally able to say what's going on, so it's crucial to pay attention to changes in behavior. The following symptoms in infants and young children would all be considered normal after a mild TBI, as long as they aren't severe or getting worse. Changes in mood. Your child may become more cranky or upset than usual. Trouble sleeping, or conversely, wanting to sleep more than normal. Another sign is being less active or playing less. They also may be disinterested in activities they usually enjoy. A regression in developmental skills can be common as well. Refusing to eat or drink can be a common symptom. And clumsiness or balance problems, including having difficulty with balance sitting or standing. Finally, increased crying or irritability or being difficult to comfort. Though concerning, these can all be normal symptoms after a mild TBI. Next, we'll review important symptoms that might indicate when something is wrong. This list of symptoms we think of as red flags. They are not a normal part of recovery and indicate something might be wrong. If your child experiences any of the following symptoms, or if they have symptoms that are severe and get worse, it's essential to seek help, call 911, or go to the emergency department right away. These include severe headaches that do not improve with rest or medication, repeated vomiting or throwing up multiple times, severe confusion or drowsiness, if your child is hard to wake up or seems unusually confused, any weakness, numbness, lack of coordination, slurred speech, or sudden change in vision. Signs would include having trouble walking, balancing, speaking, seeing, or using their arms and legs. Increased irritability or emotional changes. If your child is acting more upset or emotional than usual, it's important to take this seriously. And lastly, any seizures or convulsions. If your child is an infant or toddler, Look for crying that will not stop and refusal to eat or drink. If your child cannot be comforted, they should be evaluated urgently. Always trust your instincts. If something doesn't feel right, don't hesitate to seek help. It's better to be safe and get your child checked out by a professional. Thank you for tuning in. By staying informed about these mild TBI basics, you're taking an important step in keeping your child safe. Stay tuned for more helpful information and take care. For more information and support, always reach out to a healthcare provider. You're not alone in navigating this injury.